So let's go back to what do the tests tell us?
Yeah.
As opposed to what they don't tell us.
All right.
So if you actually look at it, as Mike explained earlier, there are two sets of tests. One detects the virus in the nasopharyngeal area, and that can either be molecular or with the protein, which is the antigen. All that. So if you think about it, if you do not have the virus present in your swabs, then theoretically you're not harboring the virus. That's all it tells you.
Yeah.
Now, what you find out is how long does the virus stay in the system probably differs from person to person. It might take 14 days. In some individuals, it might be 28 days. But realistically, the only way to scientifically prove that is to repeat the swabs. And when you get a negative swab, then theoretically, you no longer have the virus present in your respiratory system. I think I would encourage number 10 to look at the antigen testing and complement it with PCR. I would say that we don't want to basically say no to PCR, but I would actually look in terms of a test that is able to go out to the community. It's more easily accessible, it's quicker. That's the antigen test. And I would almost feel that as a front line, we use the antigen test, and the second confirmatory test, we use the PCR. So that's what we probably need to find is a very cost-effective way of combining the two tests together and actually testing the community. But I would totally agree that we do need to bring the antigen test into the game.
So one of the reasons why it might be an idea on a high-risk person to do both is that if you do the antigen, you got the result right away, and if it's positive, you can tell that person stay away and that sort of thing. But whereas if you're waiting for the PCR, that person might go home so you can literally within half an hour tell that patient, look, isolate, and then. But if it's negative, you can still back it up with the PCR and then still tell the person to isolate. But at least you know for sure much quicker, if the antigen comes back up positive.
Excellent. Okay.